A petition signed by more than 56,000 South African doctors has been submitted to the National Council of Provinces by the SA Medical Association. It's to reject the NHI bill in its current form. Some of the concerns from the Medical Association include limitations on medical aid schemes and the risk of corruption. The bill, as we know, was adopted by the National Assembly last month and now sits with the National Council of Provinces for further deliberation. Let's discuss this latest development with SAMA Chair, Dr. Mvuyisi Mzukwa. It's great to talk to you. Thanks very much for joining us this morning. When I printed the petition at around 5:30 this morning, we were at 56,020 signatures. Where are we now? I know your target is 75,000 signatures here.
Well, the last time I checked, I'm behind you, Michelle, because for me it was 54,000 when I last checked. Good morning to you and to Ayanda and the viewers at home. Thank you for having me.
So, Dr. Mzukwa, there have been several parties, several concerned parties, thousands of doctors, members of SAMA as well, who in the build-up to the bill being passed in the National Assembly in June did raise their very serious concerns against the NHI bill. It does appear that that was altogether ignored.
Yes, Michelle, I think as the South African Medical Association, we've shown that we are concerned about the healthcare system as part of the South African population. We have made submissions to the Portfolio Committee, as you know, right from the green paper, the white paper, the policy itself. We've made contributions. We even made oral presentations to the Portfolio Committee. But we do not think that this is really a meaningful engagement. We think that it's just a tick-box exercise because most of the issues that we've raised in those submissions and other colleagues, who make submissions, has not been taken into consideration. And this is just pushed ahead regardless of the fact that there is no proof of concept and there are many issues that have been raised around this bill.
I suppose the difficult part for people who are trying to understand, what it will take to implement the NHI bill, Dr. Mzukwa, is that there are very credible professionals, medical professionals as well, who have come out in the public domain and supported the NHI bill. And one of them is the outgoing medical ombud, who I think we can all agree said some interesting things about why NHI is important. And we do agree on that, don't we? That universal healthcare coverage would change the landscape in South Africa. It would suddenly give access, real quality access, to the bulk of the population, which is not currently the case. But why, under the current bill, is that not going to be possible?
Well, Michelle, we've raised a number of issues there. The other issue that we've raised was the issue of the health system capacity. It is really important that we emphasize that there's a necessity to strengthen the healthcare system, to meet the demands of the universal health coverage. This will include, adequate resourcing, the infrastructure development, as was outlined by the minister, that we don't have finances for such infrastructure. Workforce planning. You recall that we've got a document that is gathering dust there, the 2030 Human Resource for Health Strategy, where we're supposed to be starting issues of workforce planning and training programs to ensure the provision of high-quality healthcare services. Issues of collaboration, between public and private sectors. Issues that have not been, has not been harnessed, by this current bill. It's not even clear. There are uncertainties around the issues of benefit packages. There are issues about, the contracts, between service providers and the NHI. All these things that are brought up, they bring uncertainty and they are causing professionals to leave, especially if you look at the medical specialists. Medical specialists have no defined role in the NHI, and they are looking for other areas where they can, there's certainty around their role in the healthcare system. And we are not told about other issues. For example, if you look at the NHS, even though they were celebrating their 75 years, but there are huge challenges, that are facing them at the moment in terms of the human resource for health, including finance. In fact, some of them now are purchasing the healthcare services from the private sector. Some are coming to South Africa, to have operations because there are long queues. About 7.4 million of people are waiting for operations or procedures in the hospitals.
Yeah. So essentially, the point is, universal healthcare is possible even outside of NHI if we can plug the holes that exist in our healthcare currently.
Yes, we've always been in agreement with the concept of universal health coverage, because we believe that, honestly, we do need services, healthcare services that are good quality and can be accessed equitably, and also they are safe, affordable, and they don't leave any financial hardships to the communities. But this system, as we speak now, does not address those things because it only talks about just one aspect of the healthcare system, and it negates the other pillars of the healthcare system. Like, for example, your leadership and governance. The health ombudsman that you talked about earlier on, lambasted, the government for having neglected the leadership and governance in healthcare, pointing out provinces like the Western Cape, the Gauteng, the Eastern Cape, and many other provinces. In fact, he even said that picture can be painted across the country, except for some few provinces like the Western Cape. So, even issues of shortages, the minister spoke about that in Parliament, saying that there's a dire shortage of healthcare workers. So how do you talk equitable access when you don't have infrastructure, when you don't address the issues of shortages in the healthcare system, where you don't have private-public partnership in place, to make sure that all these things are addressed and people can be assured that there is this is going to be feasible. Let me just quickly make an example. I was born in the Eastern Cape in a town called Flagstaff, Emanguzu location. In 1994, the people in those villages were promised water and sanitation. And I tell you that this government has never delivered on that. There is no water. The people are relying on JoJo's and are fetching water from the rivers. And now you talk about this big promise of the NHI, when you have not addressed even the fundamental issues that are affecting healthcare. We have seen what has happened in Hammanskraal. Water is an essential element in our healthcare system.
Yeah, it's like trying to put a Band-Aid on a broken leg, right? And it brings us to the issue of corruption, Dr. Mzukwa, which is an issue that plagues our government entities across many portfolios, and perhaps particularly in healthcare. We've seen some scary stories of corruption in Gauteng, and as you say, in many other provinces as well. That's surely one of your major concerns as well, if there is an attempt to push through NHI.
What we have been requesting, and putting in our submissions to the portfolio committee was to say, let there be a watchdog that is going to guard against corruption. Because we know, what happens during the COVID-19. We know that, we've got people who are heartless in the system, who are going to take this, the funds, have access to the funds, and they will disappear before you know it. We've already noticed it during the pandemic. I mean, if you have got a disaster in a country where people are losing lives, and then you've got people are stealing the system, and you don't see anything that happens. And I mean, in Gauteng, for example, in Tembisa, I mean, where people are selling, are involved in corruption, putting orders, tenders of skinny jeans in a healthcare system. How do you trust that system that is going to work? I mean, in a system where, you find that suppliers, government to government, are supposed to be paid actually within 30 days. but it takes about 6 months for them to be paid out. So how do we trust that system that is full of corruption and inefficiencies and incompetencies?
So, Dr. Mzukwa, what happens now? Because previously you submitted written and verbal representations to Parliament outlining exactly the concerns that we've been discussing this morning. And on the face of it, they were disregarded. The adoption of the NHI bill happened in May of this year. If you do get the kinds of signatures in terms of the numbers that you're aiming for here, do you think that it will be successful in the National Council of Provinces? What will it take for there to be a listening ear?
Well, we are engaging in all these democratic processes, because we are citizens of this country. We expect that, if we talk to the NCOP, there will be a listening ear there. But, our options are still open. If we can't get joy from that, we are going to look for other options, including the legal option.
No doubt that this is a case that will see SAMA and many other entities as well going to court if indeed it is pushed ahead. Dr. Mvuyisi Mzukwa is the SAMA chairperson. Thanks very much indeed as we continue to track the issues around the NHI bill.